Dr. Eric Smith from Optimal Health Chiropractic, right next to Willis Tower in downtown Chicago. Today I'm treating one of my patients who has lateral epicondylitis. So this is that pain that comes right through your forearm like this. He's a bartender and does a lot on the computer, so he's constantly doing this type of motion and really straining a lot of the muscle in here. So the majority of the reason that, or the way that I treat this and the cause of this, is that the muscle gets too tight and then the tendons that attach into the elbow get really kind of inflamed where the attachment is. So the bone that comes through this is your radius, this is your ulna, and it should allow rotation like that. So with bartending and when people eat and drink, they tend to do a lot of this motion, or if you're left-handed, it's this. So even typing, I see this a lot because people tend to have their keyboards too high, or they're doing something like this where they're bringing their arms up. So today what I'm going to do with our patient is I'm going to use an instrument to work on the adhesions and breaking up the muscle tissue through here, or the fascial tissue through here, as well as then do some muscle release. And then I'm going to adjust the elbow as well. So this is a quick instructional video on how we do that. And if you have this issue, feel free to call our office, or if you have any questions, you can comment below. So we're going to start with his right arm first. And you said the pain's mainly through here?
Correct, and then up in here and here.
Up in there, okay. So first thing I use is a type of massage lotion that says arnica in it as well, just to kind of get a type of lubrication that we put across the skin. So when I use this instrument, that it doesn't tear at the skin, it is not going to tear as hard at any hair or anything else on the surface of the skin. So just a light little coat there. And for this first part, I'm going to actually have you bring your arm down. So what I'm doing is creating the muscle to show some tension on here. And this is just a light to medium scraping. And what I'm feeling for is adhesions, bumps, inconsistency in tissue. As you can see, he's getting a little red because I am putting some stress in there. And we're going to dig in a little bit more to this musculature in the belly of the muscle, which is right through here. And it doesn't take a long amount of treatment time to do this type of work to get the body to aim to heal that area. So what we're doing is letting that muscle flow more freely in that area. And then now, just want to check one thing as we go up. Yeah, we're going to go across here too. So do that again for me. So I'm stretching that muscle out, and now I'm just going in a different frictional pattern to kind of make sure we're breaking all this up. You know, a little bit deeper into the belly of the muscle itself. On the tendon, what I'm doing is kind of creating a signal to the body to promote more healing in this area. Good. So now that I got that part done, the next piece what I'm going to do is some active release of his musculature in that area. So we've been through this a few times. He's getting better. This is a type of thing that as you get more chronic and there's more pain in there, it takes a few more visits to get better. But it is something that as you use your hands all day, you want that to get better. Because at some point, if this continues to cause a lot of inflammation, you're going to start losing motion in your elbow. And nobody wants that. So what we're going to do for this is I'm going to have your hand splayed out like that. And then push, and then bring your fingers all the way down and make it, yeah, all the way down. Good. Fingers back up. This can be a part of the kind of painful part of the treatment, but what we're doing is, come on, back up, is we're getting the muscles to relax locally. Relax, come on, back up. So do a few different pass-throughs. Right now I'm in the belly of the muscle, so this is probably pretty tender on him. Okay, back up. Oh, there we go, let's do that. Come on back up. Even though he's feeling a lot of the pain here, this is the tendinous portion of the whole muscle, so you don't really want to keep only focusing on there, as the muscle is what's actually pulling on the tendon. Good. Very good. One more right through here, fingers all the way up. go, all the way through. Excellent. Good. Let that relax. So I'm just going to clean off a lot of this area. And then just check his range of motion. There, a little restricted in that, but he can get full, almost full at 180 there. Just relax and adjust your elbow. Good. Awesome. So now what we're going to do is I'm actually going to do the other side of his arm because he has this on both arms with being a bartender being so busy as well as the desk. It's really inflamed actually both. A lot of times I'll see most patients that it's the dominant side. So if you start to feel that pain over there, like I said, start doing some treatment on it, get a hold of us or ask any questions below and I can point you to the right way to treat your condition. After we get done with him at this part, I also do cold laser therapy, which is another therapy I would highly suggest. And you can watch us do cold laser in another video in our series here. Thank you very much.